Good morning to everyone. I'd like to thank the organization committee for inviting me this beautiful meeting. Today I'd like to present my preservation rhinoplasty technique. Everybody knows why I prefer the preservation rhinoplasty. There is ideal cases. This is the good candidate of a preservation rhinoplasty. Those are the bad candidates of the rhinoplasty because of their bad aesthetic lines, dorsal aesthetic lines, and kyphotic hump and white dorsum. This slide shows a septal approach in preservation techniques. Which technique do I prefer? In patients with minimal septal deviation, I use high septal strip or intermediate septal strip techniques. In patients with severe septal deviation, I use low septal strip techniques. In straight dorsum or slight hump, I use high septal strip. In crooked dorsum, severe hump, I use intermediate septal strip. If patient has high supratip, I use Tetris flap. With low supratip, I use Z flap. In severe humps, I do let down. In slight or moderate hump, I do push down. During the operation, I try to release all blocking points. I make radix cut with an osteotome. Under bony hump, I do incremental resection. In deep radix cases, I don't do resect under radix. I generally use ballerina maneuver. I resect Webster triangle. In Kotel technique, I make caudal 1 centimeter supraperiosteal septal elevation. Stabilization of dorsal segment is important. I'd like to present a case with a good dorsal aesthetic lines, slightly deviated to the left side. In lateral view, she has deep radix and slight hump. In endoscopic examination, left side is normal. On the right side, slight septal deviation to the right side. And left hemitransfixion incision was made. Then bilateral mucoperichondrial elevation was made. When preparing the Z flap, back cut or vertical cut of the incision must be right under the most prominent point of the hump. After flap preparation, the ethmoid perpendicular plate cut was made. I planned 3 millimeter caudal resection, but there was no resection under the radix. Then left side Webster triangle was resected. Lateral and transverse osteotomies was made in sagittal plane. Same maneuvers was made on the right side of the patient. Then ballerina maneuver was made by detaching upper laterals under the nasal bones till dorsal aesthetic lines. Radix osteotomy is made with an 2 millimeter osteotome. After osteotomy is completed, the nasal pyramid was mobile. You can see here in endoscopic view, the Z flap is on the right side of the septum and ethmoid perpendicular plate resection. The hump was gone. Then deviated part of the septum was resected. A small trim on the supratip area was made. Then Z flap was sutured to the right side of the septum with 3 stitches. I've used 5 OPDS for that. For additional dorsal stabilization, a dorsal circular suture was made. This suture was described by Teoman Doğan from Turkey. This is the picture of my patient after 15 days of the operation. dorsum is straight, but still swollen. The radix height is same, but the hump is gone. Other case examples, deviated nose to the right side, corrected, a curvy nose as she requested, straight dorsum, more natural result, straight dorsum, and also a natural result too. Thank you for your attention.